So all of you must have heard about case control, cohort, randomized trials, cross-sectional studies. I will try to make sure that you understand the differences between these and what are the hallmarks of these study designs, because when you will use these studies in systematic reviews, you need to understand कि किस study में क्या होता है, ठीक है? So I'll focus more on the differences between various types of studies. So because that is important when you want to understand the basic study designs. So this is the outline. So now what is study design? So the definition, the architecture of a study, basically what we are going to do, when are we going to do, collect data, and how are we going to do. That is the study design. So it is a scientific process of answering a question using data from a population. And this is important, the type of study design to be used depends on the type of research question to be answered. इसको हम अभी आगे as we proceed, we'll understand what does this mean. Now this is the broad classification. So study designs, basically they are divided into two, in experimental and observational. Do you know, anybody can help me with the what is the difference, what is the basis of differentiation? क्या difference होता है? क्या special करते हैं हम interventional studies में as compared to observational? It's hidden in the name. Sorry? Experimental में? This is the difference. So the exposure to intervention is not under control of investigator. Basically, we observe whatever the patient is doing, patient or population is doing. But here, in the case of experimental study, we decide that what intervention needs to be given, what is the dose, duration, frequency, and things like that. Okay? And allocation procedure into various groups. That is also decided by the investigator. I am calling myself an investigator as a researcher in the experimental studies. Clear? So what is under control of investigator? Not to decide कि किस group में जाएगा. वो randomization, that is a different process. But the kind of intervention that we are giving, that is decided by the investigator in experimental study. Clear? चलो. Ethical issues are more. Why? Because you are introducing an intervention. Now whether that is ethically to be given or not, because in control group you are not giving something. So we cannot devoid anybody of the standard thing in any study. So that is why ethical issues are more in experimental studies. Now we'll move on to the next step. In observational, there are two types of studies: descriptive and analytical. What is the difference? What is the difference between what do we do in descriptive study? कोई बताएगा example? Cross sectional and सबसे simplest. I'll first explain the difference. So in descriptive study, we generate hypothesis. We don't test it. We test hypothesis in analytical studies. ठीक है, अभी कैसे करते हैं? I'll explain. So descriptive study design, a research method that focus on observing and describing the. So basically, you describe in the terms of time, place, and person. So like I have written COVID. So COVID males में ज़्यादा हुआ, females में ज़्यादा हुआ, किस age में ज़्यादा हुआ, किस area में ज़्यादा हुआ, किस time पे ज़्यादा हुआ. When we just simply describe it, then it is descriptive study. ठीक है? And as I said earlier, they are hypothesis generating study. You are trying to generate hypothesis and not testing it. And in analytical study designs, we actually test the hypothesis that was generated in the previous studies. So we use hypothesis, we test hypothesis, we use a statistical test, and there is a p-value. So then we can conclusively say that oral cancer is common in those who are consuming tobacco. Okay? But in descriptive study, we just describe. We don't test it. Okay? Now in descriptive, case series and case report, they come under descriptive studies. So case report, we all know, we focus on a single patient, provide a detailed account of the patient's clinical presentation, diagnosis, treatment, and outcome. And the objective is often to highlight unusual or novel cases. And as is the thing with the descriptive study, they are used to generate hypotheses. Now case series, it is an extension of a case report wherein we describe a higher number of cases, generally 10, 15. And the objective is same, that you describe the clinical characteristics, you try to generate a hypothesis कि वो किस gender में ज़्यादा common है, किस age group में ज़्यादा common है, or if there are some persons with risk factors, they are commonly presenting with those diseases. Now they are easy to do, but there are some advantages of this case report and series. The first is detect novelty. So if it is a rare disease, then maybe it is difficult to do a cohort study for that. But this is easier. You can detect novel disease, hypothesis generation, and educational value. Like we publish it, we tell it to other people that okay, this kind of presentation is possible, and then cost effective and time effective because you just have to deal with single or maybe 10-15 cases. Now the disadvantages is so whatever the advantages is, the disadvantages are also derived from that because you are taking only limited number of patients. So there is limited generalizability. There is lack of control group because you just have one group, the person 15% with particular disease. You do not have anybody who is without disease. So there is no comparison group. So it is difficult to assess the cause effect relationship. Now because of these reasons, there are chances of bias and then over interpretation because you cannot generalize it because the sample size is very less. Now we'll move on to the next type, that is analytical study. Analytical studies are to test a hypothesis. So we will have statistical test and p-values. Now we'll go to each one of these studies one by one. So this we have seen. I'll skip this. So ecological study. So in ecological study, what we do is the unit of study is a population. Population, it could be city, state, or country. So I'll not talk. So there is a major limitation in ecological study, that is ecological fallacy. I'll just show you this slide to understand what ecological fallacy. All of you can read this. It's a very interesting kind of thing. So they say the Japanese eat very little fat and suffer fewer heart attack than British and Americans. So similarly, they have compared something at the pop. So the important thing here is they are comparing Japanese and British and Americans. So the unit of study is population, not any individual. Okay. And what they are concluding it, eat and drink what you like. Speaking English is apparently what kills you. So the idea is to understand that when we study at a level of population, we tend to forget the differences that are there at the level of individuals, है ना. हम यहाँ बोल रहे हैं कि इंडिया में पोल्यूशन ज्यादा है और इंडिया में उसकी वजह से कोई कैंसर ज्यादा हो रहा है, then we are maybe missing the point that there could be some individual level differences. So the unit of study in ecological study is population. Now we will move on to cross-sectional studies, and this is probably the simplest one, wherein they are also known as prevalence studies because we can estimate prevalence in cross-sectional studies. And the assessment, this is important, that assessment of study population is at a single point of time. So you contact them only once, and at that time only you ask them question about the current status of disease, the past status of exposure and things like that. But there is no follow-up in cross-sectional studies. And yes, the third point is important when we compare these studies with case control and cohort studies. So study samples are selected based on the inclusion criteria without regard for their exposure and outcome status. So if we talk about oral cancer and tobacco, so one is exposure, one is outcome. But when we select the population in cross-sectional study, we decide them on the basis of inclusion criteria. So like in this example, the patients coming to oncology OPD, irrespective of whether they had exposure or outcome or not. Okay. So this is different in case of case control and cohort studies. Now what are the advantages? Again, cost and time efficiency. You have to interview patient only once. Then you can study multiple variables. I can study about, apart from the tobacco, I can also read about the hypertension, diabetes. You have to just simply ask the question and you can study multiple variables. That is the advantage. And then prevalence estimation. So they are known as prevalence studies because we can estimate prevalence. Now this is important because you cannot establish the causality because some patients have come with the outcome, some patients have not come with the outcome. But you do not know whether the exposure came first or the outcome came first. So you cannot establish the causality. And since you are interacting with the patient only once, so you cannot track the time trend. So change over the period of time that you cannot study in this kind of study. And then the rare conditions are difficult to study, yes, because I mean the number of patients that you can interview is limited. Maybe in your sample, nobody will appear with the particular outcome that you are looking for. Now this is a typical design of a case control study. This is another type of analytical study. So now the important thing here is we select individuals on the basis of their outcome status. So we start with the diseased individual. We start from here. in the population, we divide them into two groups on the basis of their outcome. This you have to remember. In case control study, we select patients on the basis of their outcome status. First, we select cases, people with certain disease, and then we select controls in which the disease of interest is not present. So from here, you start your study, and then you go back. You go back in time and ask them about their history. So some people will be exposed in this group as well as in this group. Okay. So clear. Case control study, we select patients on the basis of their outcome, and then we ask them about their exposure status. So entry criteria is based on presence or absence of outcome and not based on predictor or exposure variables. And we assess the risk factors among those who have and those who do not have the outcome. So this is the classical example, the Doll and Hill study. So here what they did was they selected some individuals with CA lung, and then those also selected those individuals who do not have the disease, and then they look back at their exposure history. Now the advantage is this: it is good for rare diseases, because if we do a prospective study for a rare disease, it may take years, or maybe after that also you cannot see the outcome, and the duration of follow up is higher. But in case of case control study, even if it is a very rare disease, आप OPD में बैठे हैं, आपके पास cases आए, you enroll them in your study, and then you select controls. So this is the main advantage, and this is also important because for in a clinical setting it is easier to do a हम अपने BHU में भी देख ले तो केस कंट्रोल स्टडी बहुत सारे मिल जाएंगे, कोहॉर्ट हो सकता है 2 4 5 10 ही होंगे, है ना. So because they are quick and inexpensive and they are good for rare diseases, and you can study multiple exposure. You have person with disease and person without disease, and you can ask them question about multiple. So we can ask about age, we can ask about exposure to pollution, we can ask about exposure to say tobacco and hypertension, diabetes. You can ask multiple things. So you can study multiple exposures in a case control study. Now there are disadvantages as well. It is very prone to bias because there is something called as recall bias, which is very common. So the thing is that if somebody is having a disease, he is more likely to remember the exposure that he has had because उस individual को disease हुआ है. But if somebody is healthy, he may or may not remember the status of their exposure. So this is known as recall bias. Likewise, there are many biases which are they're inherent in case control studies. So why this is important? When you are looking at the conclusion of the case control study, you need to keep that in mind, that it is prone to multiple biases. Now we cannot calculate incidence. It is not possible to calculate incidence in this kind of, because for incidence we need a prospective kind of study, and this is a retrospective one. We focus only on one outcome because we have to start from the selection of cases. So we can define cases for only one particular disease, and you cannot establish causation. Causation for that we need temporality, and for that we need to do a prospective study. So all these are the disadvantages of a case control study. Now here, see the difference. In case of cohort study, out of the population we start from the exposure. So this is a classical cohort study. We always start from the exposed individual and then we follow them up. So, and based on the natural history of disease, we decide the duration of follow-up and the frequency of follow-up, and then we keep on following them up to see whether the disease emerged or not. The main advantage in case of cohort study is that you know when exposure happened and when outcome happened. So you can precisely say that which one came first. This is clear to all. You are starting from an exposed group and unexposed group. So now you know at this point of time, these many people have exposure. Now you follow them up over a period of time to see their disease status. And after 10 years, now you know these many people have disease. So you can say that exposure came first and then disease came. This is very important in epidemiology when you are establishing a causal relationship. And this is known as temporality. And this can, out of all the studies that I described, this can only be done in cohort study. So cohort study starts from exposed and goes towards outcome. You can establish temporality. That means कि क्या पहले आया, पहले exposure आया या पहले outcome आया, which is a very important criteria for cause effect relationship. ठीक है, यहाँ तक सबको clear है? The design, basic design of cohort study. Okay. So we start with the exposure and then we proceed towards outcome. They are the gold standard of observational research. Okay, because we can establish temporality in this kind of study. Yes. So there are three kind of cohort studies. First is prospective, retrospective, and ambidextrous. I'll explain it with the help of figure. So in prospective study, the outcome has not yet happened. So we are starting today and we are following them up for say 10 years in future. So from 2025 to 2035. So the outcome has not happened. Now there is one more kind of cohort study, that is retrospective cohort study. In this, the outcome has already happened, but the hallmark of cohort studies, it starts from exposure to outcome. So we go in past on the basis of records or the lab parameters that we have. We first understand that in 2014 these many people had exposure, and then we, on the basis of records, we see how many had disease in 2024. So the basic design, even if it is retrospective, will remain the same. That is, the direction is from exposure to outcome. Okay, absolutely clear? Anybody has doubt? Cohort study always from exposure to outcome. Okay, I know it is a post-prandial session. It is some people are looking thoda sa wo, but at least some basic concept should be very clear to you. Case control study from outcome to exposure, and in, ma'am, that is what I am trying to. Abhi aaya. See, one thing, retrospective cohort study happens in past. So it is in past, but we always move from exposure to outcome. So let us assume this is 2025. Okay? Now we go back in time, records, on the basis of records, and we see कि 2015 में कितने लोगों को exposure था. ठीक है? This is clear. And then on the basis of records, we see their follow-up. Suppose we are talking about blood pressure. ठीक है? अभी outcome is your hypertension and your exposure is say age. So 2014 का हमारे पास ब्लड प्रेशर है, 15 का है, 16 का है, 17 का है, लाइक 25. ठीक है, अब हमें ये पता है कि 2014 में कितने लोगों को एक्सपोजर था. ठीक है, नाउ व्हेन वी आर लुकिंग एट दिस पर्टिकुलर रेट्रोस्पेक्टिव कोहॉर्ट, even though we are sitting in 2025, the way we are studying this particular hypothesis is we are moving from 2015 to 2025. ठीक है, however in case control study, we are starting from here. We are selecting people on the basis of their outcome. In this case, even though everything has already happened, but हम start कर रहे हैं exposure से कि ये exposed individual है and हम उनको follow up कर रहे हैं कि उनको disease हुई कि नहीं हुई. ठीक है, in same kind of thing you can do both kind of studies, cohort भी और case control study भी. ठीक है, the main thing is how you are selecting, कब आप enroll कर रहे हो और किस basis पे कर रहे हो. If you are enrolling patients on the basis of their outcome, then it is case control study. If you are enrolling them on the basis of their exposure status, then it is cohort study. ठीक है, इतना तो clear हो गया. Cohort study always enrollment on the basis of exposure. Case control study enrollment on the basis of outcome. ठीक है. So now this is most important. That is why it is known as gold standard of observational studies. You can establish temporal relationship. Temporal means which one came first. Exposure पहले हुआ या outcome पहले हुआ. ठीक है. And you can study multiple outcomes. आपने exposure के basis पे select किया, and then you can look at hypertension, dyslipidemia, or maybe other cardiovascular diseases, है ना? And then incidence, because for calculation of incidence you need a prospective study with a follow-up. So you can calculate, and then longitudinal data. Now this is the problem. वो cohort study होना चाहिए, long follow-up time. And because it is a long follow-up time, it is very resource intensive. You need lot of resource in terms of manpower, money, and everything. Loss to follow-up, that is possible. कोई patient आया, आपने बोला 6 महीने बाद आना, नहीं आया, ठीक है. So that is also there. And it is not, sorry, it is not ideal for rare disease. Yeah, ये cohort होना चाहिए. Typing error. It is not feasible for rare diseases because हो सकता है आप 15 साल तक 15,000 लोगों को follow up करते रहे, but उसमें से 2 लोगों को disease हुई, है ना? Because it is a rare disease. Key questions. This is most important. whether you are measuring both at the same or different time. किसमें same time पे करते हैं? क्रॉस सेक्शनल. डिफरेंट टाइम्स में किसमें करते हैं? केस कंट्रोल एंड कोहॉर्ट. किसमें पहले एक्सपोजर असेस करते हैं? कोहॉर्ट. किसमें पहले आउटकम असेस करते हैं? ठीक है. इंसिडेंस इट कैन ओनली बी गिवन बाय कोहॉर्ट स्टडी. नाउ we'll move on to the next thing, experimental. The nature of intervention is under the control of investigator. ये सबको याद हो गया ना इन एक्सपेरिमेंटल स्टडी? ठीक है, बढ़िया. So now we will see पीछे कैसे लेंगे. What is the difference between individual trials and community trials? So basically the group or the entity to which you are allocating a particular intervention, that decides whether it is a individual trial or community trial. So like in individual trial we give an intervention to a particular individual, just one. And in community trial we give an intervention to a community or cluster, basically a group of people with certain characteristics. जैसे हाउस हो गया, हाउस में 5 लोग होते हैं, ठीक है. So एक एग्जांपल मैंने लिखा होम एयर प्यूरिफायर. So if you are giving a home air purifier, it will affect all the individuals of that particular house. विलेज हो गया. So विलेज में होता है like suppose well or supply of clean water. So that is something that is done at the village level or maybe a locality level. That cannot be done at an individual level. हम ऐसा तो नहीं कर सकते ना कि एक बंदे को supply improve कर दे. That doesn't happen. Type of salt. So suppose we are saying in state of Uttar Pradesh we are giving iodized salt, and in state of Madhya Pradesh we are giving iodized plus iron supplemental salt, and then we are comparing what are the outcomes in terms of anemia. So it depends कि किस चीज को आप इंटरवेंशन दे रहे हो. अगर वो एक इंडिविजुअल को दे रहे हो then it is a individual trial, and if you are giving it to a community then it is a community trial. Yes, so this is the definition. They are characterized by researcher actively manipulating a variable, that I have already explained. Ki the kind of intervention that you are giving is under the control of the researcher, and then it is used to test hypothesis about causal relationship by actively intervening in study environment. Now this is the typical design of a RCT. You have a study population and you define that this kind of, so suppose we are saying CA tongue, you are specifying that we will only take stage 3 disease or stage 4 disease. So that is your criteria. Those who doesn't meet that criteria, they will become non-participants. And then you invite them to participate, and then you do randomization. And then after randomization, they will be divided into 2 groups. One will be given intervention A, and then one will be given intervention B. So this is the hierarchy of evidence pyramid. We have seen this in the morning as well. So this is at the lowest, expert opinion. That is why we are doing research, because we are not interested in expert opinion. Then comes case series, case reports. The problem with case series, case report is very small sample size, so limited generalizability. The findings are applicable only to the population that is there. And then we have case control studies, and cohort studies are higher as compared to case control studies. Why? The reason is temporality. In case cohort studies, you can tell that exposure came first or outcome came first. So that makes cohort studies better than the case control studies. Then we have randomized control trials, and at the top we have systematic reviews. And that is why we have gathered here, so that we can understand what the systematic reviews are and can do the best studies in terms of evidence pyramid. Now this is an example. So suppose we are talking about neonatal health. Then if we want to understand determinants of low birth weight, then we will do analytical study. Everybody agrees? Because analytical studies are hypothesis testing studies. So we will see what are the reasons of low birth weight. So that can be answered by analytical study. And if your question is, does maternal iron supplementation result in increase in birth weight, then you will do clinical trial, because you are trying to introduce an intervention from the side of researcher. Okay. And then the next is, does a preventive program of iron supplementation to pregnant women. So this is an intervention that is applied at the community level. So for this particular question, we'll do a community trial. Now this is an exercise for you. A random sample of 5,000 people aged between 30 to 59 years living in the town of Framingham were selected and assessed for demographic, physical and biochemical factors. This actually happened. Framingham heart study, yes. So what kind of study design is this? Prospective cohort. ठीक है? Prospective means you are doing it in future. And retrospective भी आएगा. What is this? On what basis we are selecting the population? कि उनको disease है कि नहीं. This is your outcome. So this is case control study. ये बताओ ये क्या है? This is interesting. Retrospective है. इस तरह का कोई कोहॉर्ट यहाँ का बता सकते हो इंडिया में? Yes. That cohort still exists. Yes, that still exists. And उनके सर अब से That's it. If you have any doubts. But basic समझ आ गया. ठीक है. See, that is the whole objective because you need to understand the concept on which basis we divide these studies. है ना? ठीक है. चलो बढ़िया. Smoking, yes or no? He says in the past I had smoking, but not in the present. ठीक है. So we will consider him in exposure as yes or no? Yes. See, आपको define करना पड़ेगा. Case control study is a very difficult study design. लोगों को लगता है बड़ा आसान है, but it is very prone to biases and you have to decide. जैसे आप लंग कैंसर में बोलोगे ना कि स्टेज 1 to 4 लेंगे या 1 to 3 लेंगे. You have to decide your case and then you have to decide your exposure. तो जो आप एक्सपोजर डिसाइड करोगे उसी के बेसिस पे आप अपनी फाइंडिंग्स बोलोगे, है ना? So you will decide कि I will consider exposure only when the person was smoker for at least 5 years. कोई बोलेगा मैं तो एक दिन किया था दोस्त के साथ फिर उसके बाद कभी नहीं किया. That is also possible. So you have to decide. So that you have to decide, and why it is important to decide, because your findings will be applicable only to the population that you have defined in your exposure. ठीक है? Thank you, sir.